show you what it entails to adjust a pregnant patient. So the first thing that I wanted to let you know is that these tables are actually accommodated to drop down and accommodate the belly of a pregnant woman. Although I have these nice comfy pillows that we use that I feel that are just a little bit more comfortable for the pregnant patient. So today we're going to use our thicker. We have a thicker one and a thinner one depending on which trimester, and when we get close to the end, usually we have to double them up so the mom is comfortable. So go ahead, Lacey, go ahead and stand up. Good. I'm just going to position the table. Okay, Lacey, put your hands in this pocket. And we're going to slowly lower. The headpiece. Good. Okay, first we're going to do a leg check for any imbalances. Today her right leg is about an inch short, so we're going to check for sacral restriction. She's relatively even still, maybe a little bit tight on her right, which is showing me the side of sacral deviation to the right or left, so it's indicating a little bit to the right. Crack this for her. Okay, do me a favor, Lacey. Lift this leg as high as you can. And back down. This one. Good. Back down. Again, that's another test for sacral restriction. There are many hormones that are released during pregnancy, one being relaxin that helps relax the ligaments actually in the entire body, but one thing we are most concerned with during pregnancy is the pelvic region and the hips, and allowing as much space as possible for birth and pregnancy. So we really are focusing in during pregnancy to make sure that her sacrum is in proper alignment as well as her hips, because then we're providing her pelvic region with the most space for the baby. But of course, everything tends to move a little bit more because we are prepping for birth, so the ligaments become looser. So a lot of times even other areas are pretty easy to adjust, don't need too much force. A lot of times piriformis gets tight because of the postural changes, so we're going to go ahead and just stimulate that. Basically a trigger point. Good. Okay, we're going to bring her up. Well, in a second. This just feels good. Gotta pamper our mommies to be. Lie on your back for me. I'm going to remove the pillow. Most people think of postural deviations in pregnancy that it would be all low back, and pregnant women, especially as they get further and further along, do get low back tenderness, but what sometimes gets neglected or just as easily subluxated is the neck because of the postural deviations of hips come forward, presses on the SI joints, then the shoulders come back, head comes forward, we get a lot of pressure in the lower cervical. And we can really feel that on her today, which you already know. And that is adjusting a pregnant patient.